Large intestine primary channel begins at the radial side of the top of the index finger, runs proximally along the radial side of the index finger and passes through the interspace between the first and second metacarpal bones at large intestine 4, reaches the depression between the tendons of extensor pollicis longus and brevis, anatomical snuff box, where large intestine 5 is situated, continues along the lateral aspect of the forearm to the lateral aspect of the elbow at large intestine 11, rises along the lateral aspect of the upper arm to the shoulder joint at large intestine 15, crosses behind the shoulder to the depression between the scapular spine and the lateral extremity of the clavicle, large intestine 16, travels in a medial direction, passing through small intestine 12, in the centre of the suprascapular fossa, to do 14, just below the spinous process of the vertebra of C7, where it meets with the other 5 yang channels of the hand and foot. From do 14, it enters the supraclavicular fossa in the region of stomach 12 and connects with the lung before descending through the diaphragm to join with the large intestine. Another branch ascends from the supraclavicular fossa along the lateral aspect of the neck, passes through the cheek and enters the lower gums. From the gums, the channel passes through stomach 4, curves around the upper lip and crosses to the opposite side of the body at do 26 at the philtrum. From do 26, the left channel travels to the right and the right channel travels to the left to terminate either side of the nose at large intestine 20. At large intestine 20, the large intestine channel joins with the stomach channel. According to the spiritual pivot, a branch of the large intestine channel descends to stomach 37.
guys, we continue discuss the next acupoints. It's 12, Li 12. It's 周六. It's just no special nature, not a special points. We just a quick review about the points. Just important to know the location important, right? 周六 is elbow crease says. It's really based on, you know, the local anatomy. So location, look at location. Yeah, very easy find. You find the Li 11, you can find the 周六, 12. Yeah, so it's 11. You find it. Right. Action, I think just no basic action. Here not so important. Activate the channel and the pin local application. Benefit elbow joint still local application, right? Local application. So number 13 is Li 13, no special nature. You call it 手无理. You call it arm 5 miles. This one no special nature. Just separate to lateral epicondyle of the humerus on the line join the Li 11 and 监狱 Li 15. Li 15 is important point we discuss more. Here just remember 3 twin, right? 3 twin. So the 3 twin separate to the Li 11, right? And here 锯齿, 然后 brachial border humerus and 3 twin above 锯齿, 3 twin above the 锯齿. Yeah. So it's located at 1/3. You know about 1/3. You can see 1/3 the distance between Li 11 Li 11 and the axillary folds. Avoid injury arteries. Here's the artery. Be careful that. Find the border, lateral border bicep muscle is almost between the bicep muscle and the shaft of the humerus. Okay. Needling just half twin and 1 twin. Very straight, 13. Yeah. Next one is typical. This 13 typically treat local. A lot of time benefit local. Activate the channel and elevate the pain. Number 2, elevate the pain. Elevate the cough. Cough really seem like Li channel points regular lung channel, lung disorder, lung organ disorder, elevate the cough. Still, number 3, regular qi, drain the dampness and transform the phlegm, scrofular and sleepiness. But this phlegm is based on the scrofular. Really body, some we call nodules and some benign tumors. This we call it invisible phlegm. So 14 is same, yeah. B now is upper arm, yeah, 9, no special natures, and location on the line joint Li 11 join Li 15, right? 7 string above the 锯齿, 7 string above the 锯齿 Li 11 on the radial side of the humerus, superior to the lower end of the muscle deltoids. This point needed to locate when the muscle of the upper arm are tensed. Example, adduction. Abduction. Abduct upper arm. Yeah. So look at these pictures, right? 14 about 7 twin. Then the muscle related, especially related, you find the deltoid muscle. Deltoid muscle is important to find that superior to the lower end. Your deltoid muscle right here attached to the deltoid tuberosity. Yeah, it's big bony landmark. You will learn that. And needling just 0.8 twin and 1.5 twin. Here is reaching the muscle. Actions and remove obstruction from the channel and stop pain. The channel disorder, right? Still bright eyes. You can try that. It's not so powerful. Just clear and enhanced vision of the red, swelling of the pink eyes or painful eyes, right? Eyes pain, right? Number 3, resolve phlegm and disperse masses. Same like 13. It's because it's phlegm. Remember, invisible phlegm. It's masses, nodules, right? Bumps, scrofular stuff, are not visible phlegm, not just phlegm cough out, not mucus, right? Yeah. So Next one important on the list. You can check the video, right? Peter demonstrates the locating the Li15 is a big one because this we use a lot for the shoulder pain. So we call it 肩域 based on the shoulder bones. So it's crossing point, right? Li, large intestine channel and 阳桥. Yang future you learned. Yang merely respond to the body movement. The qiao means the motility, right? Motility. So yang qiao. So location important. This is so important. Location is located anterior inferior to the acromion on the upper portion of the muscle deltoids. When the arm is the full abduction, and the point is in the depression of period at the anterior border of the acromioclavicular joint. Yeah, do the abduction, you can find depression, find the depression, then that point located. Look at the net very clear. You find deltoid muscle, you find the clavicle, you find the scapular and spine, find the rich acromion right here. It's just a little bit lateral and anterior to the two bones, right? Conjunction bone right here. Yeah, so this point right here. So still we can see the puncture needling technique. You can do perpendicular or oblique, 0.8 twin, right, or maybe 1.5 twin. My experience, you can puncture two ways. Perpendicular, you have to toward to the armpit. This way. Another one is oblique. You just follow the muscle contour, especially find the biceps tendon, bicep long head tendon. So the needles go follow parallel to the tendon. Yeah, it's downward, transverse, oblique, downward. Yeah. So actions: dispel wind, dampness, elevates pain and benefit the shoulder joint. It's a very popular use, so I recommend it because in our clinic we use a lot for this. Li15 to the shoulder pain. A lot of shoulder pain include frozen shoulder and some muscle injury around the shoulder and some of the tendinitis. Right. Number 2 is eliminate wind and regulate blood. This is treat the skin problem. You can try this. It's good use. Good to use. Yeah, urticarians, allergic. Yeah. So number 3, regulate qi and resolve phlegm nodules, same like Li14, Li13. Yeah, similar. It's just invisible phlegm. 16 just for reference because it's no special nature, great bones. The final two bones, right? And the spine, scapular, and the clavicle bone, you find the gap right here, the space. So in the upper aspect, the shoulder in the depression between acromial extremity of the clavicle and the scapular spine. So it's easy to find it. You can do palpation. You find the points. Find points between two bones. So perpendicular, half twin. Or maybe 0.7 twin, not so deep. Yeah. So actions. One action is activate the channel, elevate the pain, benefit the shoulder joint, still benefit shoulder, especially the pain related to that we call the supraspinatus, the muscle. Yeah, supraspinatus muscle, because there is right there in the attachment, right? Supraspinatus muscle. Yeah. So if the shoulder pain, muscle related super spinatus, the muscle. This muscle use a lot of time get injured, right? Easy to injure muscle. Pain and limited mobility of the shoulder and back, right? Number 2, regulate qi without phlegm nodule, same like with number 15. Number 14, 13 stuff is to treat the invisible phlegm, the masses, some the nodules, some bumps. It's benign, not a malignant tumor. Yeah. So next one, 17 is the important point. I put in the list, blackboard. You still watch Peter's demonstration that locate the point. So 17, 天点, they call it heaven tripod. Heaven tripod. So no special nature. On the lateral side of the neck, 1 twin below, full 2, Li18. on the posterior border of the mastoid process, and posterior border of the, you know, SM, you know, is sternocleidomastoids. Yeah, mastoids, the muscle. Yeah, you will learn that. I think you learn that, right? So it's muscle, this muscle contour, right? This muscle, because this muscle have two heads, so this posterior border, right? Posterior border. So 18, you know, LR18 is just between the two heads, between two muscle belly, but 17 just behind or the posterior border of the whole muscle belly, right? So this picture show clear. Yeah, everything clear right here. Look at this picture. Look at this picture, right? Just the ventry away from each other. Yeah, right? Yeah, it's very clear. Yeah. You know, around the SM, so many points. Yeah, future you will learn. You know, SM muscle is so many points around here. And yeah, still important. It's a big vein, external jugular vein. Be careful that, and the transverse, you know, cervical nerves. So if you puncture here, still control your depth. So perpendicular 0.3 twin or 0.5 twin. Good. Control depth. Still check feedback from your client. And number one, the clear heat, reduce swallowing and benefit throat. Yeah, that's a very good one. Sore throat and loss of voice. Swelling can treat local some thyroid glands. Swelling, you know, thyroid gland swelling helps. And still to local sore throat. 17. Number two, regulate the qi, resolve the phlegm nodules. These phlegm nodules, scapula goiters around neck. Goiter, we know that it's benign, you know, the hyperplasia of the thyroid glands. But we still make sure you know it's benign. If malignant, it's not suggest to do that. Okay. 17, remember this. But I'll just add a little bit more. 17, you can still benefit the frozen shoulder or shoulder pain. Yeah, it's better frozen shoulder. Try that. Not on textbook. It's some new findings, right? Next one, 18. 18, we just know support the name. It's called Fu Tu. Fu Tu support permanence. Support permanence. It said seems like local. You know, for the man, we have Adam apples, right? Local the thyroid cartilage, right? Seems like support the permanence. No special nature. This one not so important. Just know the location. We mentioned before, right? You find the muscle, sternocleidomastoid muscle, between the two heads. Between which two heads? One has sternal head, or another one is clavicular, clavicular head and sternal head. So look at the picture. Yeah, look at the picture. You should before the picture. Yeah, yeah. Okay. And still action benefits throat and the voice. Benefits, you know, number action, one action seem like 17. Benefit local, right? Throat and the voice. And number two, relieve the cough. Number three, resolve the phlegm and disperse messes. Similar like 17 stuff. I think just we don't want to spend more time. Just know the basic one. Scapula goiter, right? Relieve cough is cough, visible and asthma is local application. Just a system point, not the main point, not the main role. Okay. 19 just the 口喝料, just still no special nature, and the green bone horns, you know, this so it's a location is right below the lateral margin of the nostril, 0.5 lateral to the range zone to 26, right? Oblique 0.2 twin, 0.3 twin, very shallow because the whole lot not too much muscle here. It's, you know, lips, right? Right here, right? Right here. So right here, yeah, 口喝料, 19, yeah. Here's just you know, not reaching the muscle, but it is deep. You can find the bone. Yeah. So actions eliminate wind, open the nostril. It benefit nasal problems, right? Nose problems, nasal congestion, discharge, loss of sense of smell, nasal sores, nasal pulped lips, and rhinitis with nose bleed. Right? Next one, 20, big one. The 20 we have on the list. Okay, remember 印象 is very good one, welcome fragrance, and Cross point, the lung li channel and the stomach channel. Both are yang ming, right? Foot yang ming, hand yang ming. Li stomach, li stomach. So how to locate in the nasolabial groove? Yeah, if you find the nasolabial groove, you find the point at the level of the midpoint of the lateral border of the nasal nazi. So it's based on local body landmark, right? Not oblique, needling, oblique, sub, same like sub. You can do oblique or the sub oblique or maybe transverse. They call transverse still, called transverse sub, right? And it's very shallow, 0.2 twin, 0.3 twin oblique. Subcutaneous, just below the skin, subcutaneous, the cutaneous. So it's right here, Li20, right? Li20. Very easy to find it, very good point to use, right? Right here, yeah. Here, extra point B tone. Future you learn extra point B tone. It's very close. Actions typically strong action to open nostril passage, nasal passage, open nasal passage, and number 2 expel wind and clear heat. So it's a lot of local application for the nasal problem. Nasal congestion, discharge, loss of sense smell, nasal sore, and nasal pop lips, and sneeze, and nose bleeding. Yeah. So still benefit division mouth, swelling in the lips, heat of the redness and eyes. Sometimes you can use this point to treat some stroke and facial paralysis stuff. Just one of the assistant point. For this, second action not so often use that actions. So we finish. Give you example how to commonly combination at like 20 B-tone and yin tone. Actual points, is treated in the allergic rhinitis, chronic rhinitis with heat at Zanzhu is blend 2. Future you learn blend channel point. Acute or chronic nasal sinusitis, right? Nasal sinusitis. The clamp position still point seated. Look at the picture. Very good, right? A very clear picture. Yeah, very easy. But right away after acupuncture, you feel much better. Of course, still, except for local application, you can combine other points based on the pattern, right? Like kidney qi deficiency or lung qi deficiency, you have to add other point to make the problems, totally healed, right? Here's summarization of the LI specific points, right? Jingwei point, you know that. Remember number 1, 2, 3, 4, 11, and so low Hershey point future will learn stomach 37. Yeah, watch the video, primary pathway dimension stomach 37, lower Hershey point. Yuan Song point Li 4, and low connecting Li 6, she cleft Li 7. Front move future learn the stomach on the belly, right? Stomach 25 on the belly. Backstroke point is UB 25 or blend 25. Blend 25 for the Li organs, large intestine, promote bowel movement and still can treat the diarrhea. Yeah, can treat diarrhea. Yeah, we finished.